Hello, I'm Professor Capron. Welcome to this presentation on sinus tachycardia. Let's look at the learning objectives for this presentation. By the end of this presentation, you'll be able to identify the ECG characteristics of sinus tachycardia, understand the physiological mechanisms behind sinus tachycardia, assess and manage patients presenting with sinus tachycardia, and recognize related conditions and their impact on sinus tachycardia. These are the key terms for this presentation. Please make sure you understand each of these terms thoroughly. If you're struggling with any of them after the end of this presentation, please come and see me in class so we can fix it for you. When identifying sinus tachycardia on an ECG, there are several key characteristics to look for. The rhythm in sinus tachycardia is regular. This means that the intervals between each heartbeat are consistent. The heart is beating faster than normal, but it maintains a regular, steady pace. In sinus tachycardia, every P wave is followed by a QRS complex. The P wave represents atrial depolarization, which means the atria are contracting and sending blood into the ventricles. This is followed by the QRS complex, which represents ventricular depolarization, indicating the ventricles are contracting to pump blood out to the body. One of the defining features of sinus tachycardia is a heart rate exceeding 100 beats per minute. This is the primary indicator that differentiates sinus tachycardia from normal sinus rhythm, where the heart rate is between 60 and 100 beats per minute. It's essential to count the heart rate accurately, as this is a critical diagnostic criterion. The PR interval measures the time from the onset of the P wave to the start of the QRS complex. In sinus tachycardia, this interval remains within the normal range of 0.12 to 0.2 seconds. This indicates that the electrical impulse is traveling from the atria to the ventricles in a typical time frame, despite the increased heart rate. The QRS duration represents the time it takes for ventricular depolarization. In sinus tachycardia, this duration remains within the normal range of 0.006 to 0.12 seconds. This suggests that the ventricles are depolarizing and contracting efficiently, even though the overall heart rate is elevated. Understanding these ECG characteristics is crucial because they help to distinguish sinus tachycardia from other types of tachycardia and arrhythmia. By confirming these features on the ECG, we can ensure that the rapid heart rate is indeed originating from the sinoatrial node, as it should be in sinus tachycardia. This differentiation is essential for determining the appropriate clinical response and management. Understanding the physiology of sinus tachycardia involves examining the role of the SA node and the various stressors that can trigger an increase in heart rate. The sinoatrial or SA node, located in the right atrium of the heart, is known as the natural pacemaker of the heart. It initiates electrical impulses that travel through the heart, causing it to contract and pump blood. In sinus tachycardia, the activity of the sinoatrial node is increased. This means the SA node is sending out electrical impulses at a faster rate than normal, leading to an increased heart rate. Various physical stressors can lead to increased SA node activity, resulting in sinus tachycardia. These stressors act on the body and can cause the heart to beat faster in response to a perceived need for more oxygen and more nutrients. Common stressors include fever. When the body has a fever, it is fighting off an infection or illness. The metabolic rate increases, and the body requires more oxygen and nutrients to support the immune response. This increased demand causes the heart to pump faster. Pain can activate the sympathetic nervous system, releasing adrenaline and other stress hormones that increase heart rate to prepare the body to deal with the source of pain. Anxiety and stress activate the body's fight or flight response, releasing adrenaline and other hormones that increase heart rate. This is a natural response to prepare the body to either confront or escape from perceived threats. Physical activity requires more oxygen and nutrients from muscles. During exercise, the SA node increases its firing rate to supply the body with the necessary blood flow, leading to a faster heart rate. The autonomic nervous system plays a crucial role in regulating heart rate. The sympathetic nervous system stimulates the SA node to increase heart rate in response to stressors, while the parasympathetic nervous system can slow it down. During situations of increased demand, such as fever, pain, anxiety, or exercise, the balance shifts towards sympathetic stimulation, causing the SA node to increase its rate of firing, thus increasing the heart rate. Recognizing the physiological basis of sinus tachycardia is important for identifying and managing the underlying causes. By understanding that increased SA node activity is a response to physiological stressors, healthcare providers can target the root cause of the increased heart rate. For example, manage a fever with antipyretics, relieve pain with analgesics, address anxiety with anxiolytics or talk therapy, and advise on safe exercise practices to help control episodes of sinus tachycardia. Assessing sinus tachycardia involves a thorough evaluation of the patient's presentation, hemodynamic status, and continuous monitoring of the heart rhythm. Here's a look at how to conduct this assessment. Patients with sinus tachycardia often report feeling palpitations. This is described as a sensation of a rapid, strong, or irregular heartbeat. It's important to ask patients to describe how their heart feels when the palpitations occur and if there are any associated activities or stressors. Dizziness can occur due to decreased cardiac output or inadequate blood flow to the brain when the heart is beating too fast. Assess if the dizziness is constant, occurs with specific activities, or is accompanied by other symptoms such as lightheadedness or fainting. Rapid heart rates can lead to inadequate oxygenation of tissues, causing patients to feel short of breath. Evaluate if the shortness of breath occurs at rest or with exertion, and if it's associated with other symptoms like chest pain. Monitor the patient's blood pressure regularly. Sinus tachycardia can sometimes cause hypotension due to decreased filling time of the heart, resulting in reduced stroke volume and therefore cardiac output. Regularly check the patient's pulse rate and quality. A rapid indicate a significant increase in heart rate. Compare the apical pulse with the radial pulse to ensure they are consistent and check for any pulse deficit. Assess the patient's general condition. Look for signs of hemodynamic instability, such as altered mental status, diaphoresis, cold and clammy skin, and decreased urine output. These signs suggest that the body is not perfusing well due to high heart rate. For patients presenting with symptoms of sinus tachycardia, continuous ECG monitoring is essential. This allows for real-time observation of the heart rhythm and immediate detection of changes or abnormalities. If continuous monitoring is not possible, perform routine ECGs to confirm the diagnosis of sinus tachycardia. Ensure that the ECG shows a regular rhythm, a rate greater than 100 beats per minute, a P wave preceding each QRS complex, and a normal PR interval and QRS duration. Any changes in the ECG and correlate these with the patient's symptoms. Look for any other abnormalities that might suggest a different or concurrent condition, such as ischemia. Perform a thorough physical examination focusing on the cardiovascular and respiratory systems. Check for jugular venous distension, auscultate heart and lung sounds, and assess for peripheral edema. Take a detailed patient history to identify any potential triggers for sinus tachycardia. Ask about recent illnesses, medication use, caffeine or alcohol intake, any illicit drug use, stress levels, and exercise habits. Depending on the clinical presentation, relevant laboratory tests such as thyroid function tests to rule out hyperthyroidism, complete blood count to check for anemia, and electrolyte panels to identify any imbalances. Now let's look at the medical management of sinus tachycardia. First, we want to treat any underlying causes. One common cause of sinus tachycardia is fever. The body's metabolic rate increases with fever, leading to an elevated heart rate. Management involves treating the fever with antipyretics, such as acetaminophen or ibuprofen. Additionally, addressing the underlying infection or condition causing the fever is crucial. Ensure the patient is adequately hydrated and comfortable. Pain can stimulate the sympathetic nervous system, resulting in tachycardia. Assess the patient's pain level using appropriate pain scales and manage it effectively with analgesics. Depending on the severity of the pain, medications may include NSAIDs, acetaminophen, or opioids. Non-pharmacological methods such as relaxation techniques, ice or heat application, and physical therapy can also be beneficial. Anxiety and stress can trigger the release of adrenaline, causing an increase in heart rate. Addressing anxiety involves both pharmacological and non pharmacological approaches. Pharmacological treatments may include anxiolytics, such as benzodiazepines, for short term relief. Non pharmacological methods include cognitive behavioral therapy, or CBT, mindfulness, relaxation techniques, and counseling, encouraging the patient to engage in regular physical activity and ensuring a supportive environment can also help to relieve anxiety. In terms of medications, let's look at a few very common ones. Beta blockers, such as metoprolol or atenolol, are commonly used to manage sinus tachycardia. These medications work by blocking the beta adrenergic receptors in the heart, reducing the effects of adrenaline and slowing the heart rate. Beta blockers are particularly useful in patients with coexisting conditions like hypertension, ischemic heart disease, or anxiety. It's important to monitor for side effects such as bradycardia, hypotension, and fatigue, and to titrate the dose appropriately. Calcium channel blockers such as diltiazem and verapamil can also be used to control the heart rate in sinus tachycardia. These medications inhibit the influx of calcium ions into cardiac cells, increasing heart rate and contractility. They are particularly useful in patients who may not tolerate beta blockers or who have contraindications to their use. Monitor for potential side effects, including hypotension, bradycardia, and peripheral edema. In some cases, a combination of beta blockers and calcium channel blockers may be necessary to achieve optimal heart rate control. This approach requires careful monitoring to avoid excessive bradycardia or hypotension. We need to look at some additional considerations. Assess and correct any electrolyte imbalances that could be contributing to the tachycardia. Common imbalances include hypolemia and hypomagnesemia, which can exacerbate arrhythmias. Correcting these imbalances involves appropriate supplementation and monitoring of serum levels. Hyperthyroidism can cause sinus tachycardia, so evaluate thyroid function tests to rule out hyperthyroidism as a cause. If hyperthyroidism is diagnosed, appropriate treatment, such as antithyroid medications, radioactive iodine, or thyroidectomy, should be initiated. Dehydration can lead to tachycardia. Ensure the patient is well hydrated, especially in the presence of fever or illness. Encourage oral fluid intake or administer intravenous fluids to maintain adequate hydration. Educate the patient on lifestyle modifications that can help to manage sinus tachycardia. Encourage stress management techniques, regular physical activity, and a balanced diet. Advise the patient to avoid excessive caffeine and alcohol intake, as these can exacerbate tachycardia. And emphasize the importance of medication adherence. Ensure the patient understands the dosage, timing, and potential side effects of prescribed medications. Encourage the patient to report any adverse effects or concerns. Now let's look at the nursing management of sinus tachycardia. Start by taking a detailed history to identify potential causes of sinus tachycardia. Ask about recent illnesses, symptoms of infection, pain, stress levels, and any recent physical exertion. Perform a thorough physical examination, focusing on signs that point to specific causes, such as fever, dehydration, or signs of anxiety. Certain medications can cause or exacerbate sinus tachycardia, so review the patient's current medications, including over the counter drugs and supplements. Common culprits include bronchodilators, decongestants, and some antidepressants. If a medication is identified as a possible cause, collaborate with the healthcare provider to adjust or discontinue it if appropriate. Relevant laboratory tests to check for underlying conditions. This may include complete blood count to look for infection or anemia, thyroid function tests to rule out hyperthyroidism, and electrolyte panels to detect imbalances. An ECG will help confirm the diagnosis and rule out other arrhythmias. For patients presenting with sinus tachycardia, continuous ECG monitoring is essential. This allows for real-time assessment of the heart rate and rhythm, helping to detect any changes or complications. Regularly monitor the patient's vital signs, including blood pressure, heart rate, respiratory rate, and oxygen saturation. Sinus tachycardia can lead to decreased cardiac output and hypotension, so it is important to detect these changes promptly. For patients who are hemodynamically unstable, more advanced monitoring may be required. This can include arterial line placement for continuous blood pressure monitoring or central venous pressure monitoring to assess fluid status. Educate patients on the symptoms of sinus tachycardia, such as palpitations, dizziness, shortness of breath, and fatigue. Encourage them to report these symptoms promptly, especially if they occur frequently or become severe. Help patients identify common triggers for sinus tachycardia. These can include stress, caffeine, nicotine, alcohol, and certain medications. Teach them to avoid or minimize exposure to these triggers. For example, suggest reducing caffeine intake by switching to decaffeinated coffee or tea and avoiding energy drinks and other stimulants. Teach patients effective stress management techniques such as deep breathing exercises, mindfulness meditation, and progressive muscle relaxation. Encourage regular physical activity, which can help to reduce stress and improve overall cardiovascular health. Encourage patients to follow a heart healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Advise them to limit intake of processed foods, high sodium foods, and sugary beverages. Proper nutrition supports overall heart health and can help to prevent conditions that may contribute to sinus tachycardia. Advise patients on the importance of regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, such as brisk walking, swimming, or cycling. Exercise helps to maintain a healthy weight, reduces stress, and improves cardiovascular fitness. Emphasize the importance of hydrated, especially in hot weather or during illness. Dehydration can exacerbate sinus tachycardia, so encourage patients to drink plenty of water throughout the day. If the patient smokes, provide resources and support for smoking cessation. Nicotine is a stimulant that can increase heart rate and contribute to sinus tachycardia. Smoking cessation programs, nicotine replacement therapy, and counseling can be beneficial. Encourage patients to attend regular follow up appointments with their healthcare provider to monitor their heart health and manage any underlying conditions. If medications such as beta blockers or calcium channel blockers are prescribed, ensure that patients understand the importance of taking them as directed. Educate them on the potential side effects and the importance of not abruptly discontinuing the medication without consulting their healthcare provider. Now let's look at some related conditions and their significance when it comes to sinus tachycardia. Hyperthyroidism occurs when the thyroid gland produces excessive amounts of thyroid hormones, T3 and T4. These hormones regulate the body's metabolism and influence heart rate. Increased thyroid hormone levels can elevate the metabolic rate, leading to an increase in heart rate. This is because thyroid hormones enhance the sensitivity of the heart to catecholamines, adrenaline, and noradrenaline, which stimulate the SA node to increase the heart rate. Patients with hyperthyroidism may present with symptoms such as palpitations, weight loss, heat intolerance, and tremors. Managing hyperthyroidism can help to control the elevated heart rate and alleviate symptoms of sinus tachycardia. Treatment options include antithyroid medications, radioactive iodine therapy, or thyroid surgery. Anemia is a condition characterized by a decrease in the number of red blood cells or hemoglobin, resulting in reduced oxygen carrying capacity of the blood. When the body detects low oxygen levels due to anemia, it compensates by increasing the heart rate to enhance oxygen delivery to tissues. This compensatory mechanism leads to sinus tachycardia. Symptoms of anemia include fatigue, pallor, shortness of breath, and dizziness. Identifying and treating the underlying cause of anemia is essential. This may involve nutritional supplements like iron, vitamin B12, or folic acid, blood transfusions, or treating any underlying conditions such as chronic kidney disease or gastrointestinal bleeding. Heart failure is a condition where the heart is unable to pump blood effectively, leading to inadequate circulation of blood to meet the body's needs. In heart failure, the heart tries to compensate for its reduced pumping ability by increasing the heart rate. This compensatory tachycardia aims to maintain cardiac output and perfusion to vital organs. Patients with heart failure may exhibit symptoms such as shortness of breath, edema, fatigue, and reduced exercise tolerance. Managing heart failure involves medications like ACE inhibitors, beta blockers, and diuretics, lifestyle modifications, and in severe cases, advanced therapies like ventricular assist devices or heart transplantation. Controlling the heart rate is a key aspect of heart failure management to improve symptoms and quality of life. Dehydration occurs when there is an excessive loss of bodily fluids, which can be due to various factors such as prolonged vomiting, diarrhea, excessive sweating, or inadequate fluid intake. Dehydration leads to a reduction in blood volume, prompting the heart to increase its rate to maintain adequate blood pressure and perfusion. This compensatory mechanism can result in sinus tachycardia. Symptoms of dehydration include dry mouth, thirst, decreased urine output, dizziness, and tachycardia. Rehydration is the primary treatment, which can be achieved through oral fluids or intravenous fluids in severe cases. Identifying and addressing the cause of dehydration is crucial to prevent recurrence and associated complications. Let's do a quick summary of what we've covered. The ECG characteristics include a regular rhythm, a P wave followed by a QRS complex for each heartbeat, a heart rate of greater than 100 beats per minute, and normal PR and QRS intervals. Physiologically, we know that we have SA node activity that has increased due to stressors such as fever, pain, anxiety, or exercise. We looked at the need to monitor both the ECG and any symptoms and medical management of underlying causes or any medications that the patient might need to take to help slow the heart rate. We also looked at patient education and the importance of lifestyle modifications, such as stress reduction techniques, adequate hydration, and avoiding any stimulants. So thank you very much for paying close attention to this presentation. Remember, as always, get out there, go do some nursey things.